Hi, it's Dr. Evan Hughes, and I want to talk today about how chiropractic can help relieve some of the tension from TMJ or TMD, temporomandibular dysfunction, or pain in the jaw. What we've noticed in practice is anybody whose body has gone into defense, who's protecting itself, the head comes forward, the neck locks up, and the jaw goes under tension. This can come from any type of insult or stress coming in from the environment. Either the person's in a car accident or they have a job that's very stressful to them. It locks up through the system. So one of the things that happens is the body gets ready by contracting the muscles on the side. If this happens irregularly or different from right to left, it can start to pull the soft tissue and create scarring on one of the other sides of the TMJ joint. So that's the first problem. The second thing you can do is take the entire cranium and rock it offline. Now the cranium doesn't move in and out like fish gills, that would be silly. But like a house settling, it moves a few millimeters and creates a tension pattern that causes the jaw to hinge offline every single time, putting more stress and more inflammation into the system. Just like when you stub your toe and it gets all inflamed, it can do the same thing through here. And this can become incredibly painful. It can shoot like lightning up and through the ears. It can create head, neck, and shoulder tension. It can mess with your concentration because it's changed your circulation through the whole system. So TMJ can be a mess unless it's moving right. Another thing that can happen is it can take C3 and C4 bone or vertebra in your neck and twist it offline. Again, all of these things working together to try and make it work as best it can. But when all of these things are all in locked position, it decreases that circulation and there's a lot of static on all of the nerves. So the chiropractic method and the way that we treat TMJ or folks suffering with these problems is we address the cervical spine, the upper neck here to get that to release, address the muscles, reset the jaw, and address the cranium so that everything is free and open. Now, sometimes, of course, there are additional problems to clean up, but after you've set the base of how the TMJ moves and everything is circulating freely, it will take you easily most of the way there and will set the tone for whatever else you have to do to finish the job of healing.